Order! Order! You are an incorrigible delinquent at times. Behave yourself, man!
Now, the Health Secretary, Jeremy Hunt, has been told by officials to stop warning of dangers to patients from inadequate staffing of hospital accident and emergency departments at weekends. In a further leak of documents from inside the Department of Health to this programme, senior civil servants say that if he really wants to implement a 7-day service, he should stress the benefits rather than playing up risks that the public don't believe. Here's our health and social care correspondent, Victoria MacDonald.
It's called the weekend effect, a disputed statistical claim that patients admitted at the weekend are more likely to die than those taken into hospital during the week.
You are 15% more likely to die if you're admitted on a Sunday.
If you have a stroke at the weekends, you're 20% more likely to die. That can't be acceptable. It's not acceptable to have mortality rates at the weekend that are 11 to 15%.
Statistics central to the Health Secretary's argument for a 7-day NHS in England and the reason given for changing the junior doctor's contract. Okay. But now Jeremy Hunt has been delivered what appears to be a rap over the knuckles by his own civil servants.
Channel 4 News and the Guardian newspaper have been leaked a series of documents from health officials in which they warn the government about their plans for a 7-day NHS. Now, in this latest leak, there is a clear message from those same civil servants to ministers. Stop talking about the weekend effect.
The document from the 7-day services governance group says
the link to the weekend effect has not been helpful for 7-day service, as our insight tells us that patient safety is not top of mind for the public or the workforce.
It goes on to say that they need to talk about the benefits of 7-day services, including the provision of high-quality care, convenience and access. As we reported last night, civil servants have warned the government there is a risk of failure, that they may not meet the 2020 deadline because of lack of funds, staff, data and evidence. Now there are growing calls for an inquiry into the government's plans.
I think there needs to be an inquiry. Jeremy Hunt appeared to deliberately flouted the advice of his officials, and there definitely needs to be a moratorium on both the introduction of a 7-day NHS and forcing the junior doctors to sign these new contracts.
In the same leaked document, civil servants also warn
the current financial context means we need to demonstrate that the 7-day service is achievable and realistic.
We have consistently warned this government that actually they needed to come out with a clear plan of how we were going to achieve 7-day services. And so what we have in effect is a lot of words or sound bites that says we will deliver 7-day services without a concrete plan of how that will be delivered, and the discussion that it will require more resources, whether that's staff or money.
A Department of Health spokesman said,
the benefits of a 7-day service for patients are wide-ranging. A safer NHS, more choice and better access to services. But we make absolutely no apology for prioritising patient safety.
But what civil servants also say in their advice to Mr Hunt is there is as yet no evidence one way or another that a 7-day service will achieve that very aim, making the NHS safer.
As a country, we probably do have some serious thinking to do about what the National Health Service can and cannot provide now and in the future. Growing population, longer lives, we've rehearsed the arguments many times. What we can say for sure is that until we and our politicians decide to spend more or work out a way of saying no, the NHS will be squeezed hard. And just how hard is illustrated by some new figures we have obtained. Over the past year, 16 hospital trusts in England have had to close down the likes of stroke, maternity and paediatric services due to staff shortages. The picture of what is really going on was put together by our health editor, Rachel Younger.
Right across the country, our hospitals are playing a numbers game, competing for their fraction of a limited pool of doctors and nurses to keep pace with a growing number of patients and their demands. What you get is not an outcome any patient wants. ITV News has discovered some hospitals are taking drastic measures when they can't get their own staff to keep plugging the gaps.
On the 18th, I did another long day.
Obstetrician Reena Agarwal does that regularly, working 13 out of the last 15 days. But some shifts are still badly understaffed.
I'd be in the middle of doing one thing and then I get called to do another thing and then I get called to do another thing. And I just, and you feel like you just feel very dissatisfied because you don't feel like you're giving anyone your full attention.
And when you have those shifts, are you operating right at the margins of patient safety?
Yeah, of course you are. Of course you are.
And without enough staff to cope, ITV News has discovered more hospitals are opting for the last resort. We asked every hospital in England if they'd suspended any acute services due to shortages of doctors and nurses in the past year. Of the 112 who responded, 16 said they had, on some occasions repeatedly. Among them, Airedale NHS Trust, which suspended maternity services 11 times in 12 months. East Cheshire, which suspended its maternity service twice and paediatric services 19 times. And the Princess Alexandra in Essex, where the stroke unit hasn't opened since April. It also includes Chorley Hospital, whose decision to downgrade its A&E has meant more patients at Preston, where Joy, who has cancer, waited for 5 hours.
I just wanted to die, to be quite
Yeah, she asked me, am I dying, Mary? The ambulances were piling up outside, 4 or 5. They couldn't even get into the corridor because the corridor was absolutely packed with trolleys.
That's not many. How many beds?
No, because I've got 20 beds.
But even hospitals who have kept services open say it's getting increasingly tough to find enough staff.
It can take literally hours of our HR colleagues and our managers working together, working with the people that provide agency doctors and agency nurses, hours each day just trying to make these rotas safe.
No hospital wants to put its patients at risk. But if there aren't enough staff to go round, providing safe care is going to require some very tough decisions.
And Rachel is here with me now. Rachel, I guess first we better ask for what reaction you may or may not have had from the government.
Yeah, and that's quite an interesting one, because you'll remember during the junior doctors dispute, we heard again and again from the Department of Health that there wasn't a problem with understaffing. They kept giving us the figure that there were 25,000 extra doctors and nurses on the wards since 2010. Interesting this time, they didn't dispute the notion of understaffing. Difficult, of course, when we have concrete examples of this kind showing what the impact of that has been. Instead, they pointed us towards NHS Improvement, the body that regulates hospitals. They told us patient safety has to come first. They said that the hospitals in question were right to take the steps they did to ensure that patients had been kept safe. The hospitals themselves, all of them said that alternative arrangements had been put in place. East Cheshire, for example, said some of these suspensions may only have lasted a few hours, although the information we obtained from them showed that on one occasion their maternity unit was shut for 30 hours. And Airedale, which closed its maternity unit 11 times, wanted to make it clear it had apologised to every patient who'd been affected.
OK, but I think for anyone watching this, if any of us, if we go into hospital and something was shut, you'd be a bit shocked, wouldn't you, really? And we talk so often about the NHS, and there's many allegations that it's in crisis. You spent quite some time researching this and all day talking to people. What's your sense about what we should really take away, about what this says about the true state of what's going on in the NHS?
Yeah, I think what it reveals is an NHS that is essentially running more and more on the goodwill of its staff. And what you only get when you dig a little deeper behind these figures is a picture of just how close to the wire some hospitals that haven't had to shut their doors are. As one chief executive told me this week of one of the trusts that had decided to suspend services, in my area there are trusts working at a threshold where I don't think I could sleep at night. Now, others have pointed out to me this clearly isn't a sustainable situation and that there has to be more honesty about that, more of a debate. They say there's going to be a simple choice here. Either there needs to be more significant investment or services are going to have to be consolidated, which means for patients that things that you might expect to get on a hospital at your doorstep at the moment, you might have to travel a lot further for in future. The question is whether the government is going to be tough enough to have that debate with the public.
OK, Rachel, thank you very much indeed.
I've been getting